A newborn baby takes about 40 breaths each minute. A 1-year-old child takes about 24 breaths per minute. An adult takes about 14 breaths per minute. However, during exercise, the rate can increase to over 100 breaths per minute. Adults breathe in about 7 to 10 liters of air each minute. It is our brains that control the breathing process. We don't have to think about breathing. It's automatic. The control center for breathing is found in the brain stem. It uses information from various parts of the body concerning the levels of carbon dioxide and oxygen in the blood. Based on the comparison of carbon dioxide and oxygen levels, the brain sends electrical signals to the diaphragm and chest muscles, which cause us to breathe in and out. To bring air into our bodies, the diaphragm, which is a bell-shaped sheet of muscle, contracts. This causes it to flatten, creating a larger area in the chest cavity and, as a result, a space of low air pressure. Air rushes in through the nose and trachea to fill the lungs and expand them to fill up some of this low-pressure area. When the diaphragm relaxes, it moves back into its normal bell-shaped position, which causes the chest cavity to shrink and push air out of the lungs. The lungs actually are responding to the change in pressure around them. The diaphragm and muscles of the rib cage are what cause breathing to take place. Here is a simple demonstration of how the diaphragm does its job. We will cut the bottom off this 2-liter plastic bottle. A mouth of a balloon is cut away. This balloon is then stretched over the bottom of the bottle and secured with a rubber band. A second balloon is slipped through the mouth of the bottle and held in place. Now, when the balloon, which represents the diaphragm, is pulled down, notice what happens to the other balloon, which represents a lung. When the diaphragm balloon is moved back to its normal position, notice that the other balloon releases air just like a lung exhaling. Thank goodness that the act of breathing is an automatic operation and requires no thought. If you hold your breath, after a short period of time, you automatically start gasping for breath. Your body needs a constant supply of oxygen. You are breathing while awake and while asleep. During sleeping, the breathing rate slows down because there is not as much of a demand for oxygen. Muscles are at rest, and there is less carbon dioxide being produced than during a period of high activity. Breathing during sleep is slower and more relaxed.